All right, very good. Good evening, everybody. Thank you once again for joining. This session is extremely informative. As you all know, it is the need of the hour. We had our first session on mental health matters on January 6th. We had amazing participation. We learned the basics on mental health on January 6th. We all know that this is very imperative. A lot of struggles that we go through. We are trying to normalize mental health. If we are okay to talk about our physical health, we should be okay to talk about our mental health as well. That is our goal. So today it is going to be a little bit more intensive session where we are going to talk about the core areas of mental health and also do a little bit of, case analysis. We all know that this session will be conducted by Dr. Maju Matthews, who's a board certified psychiatrist from Southern New Jersey, right? South Jersey. All
Mhm.
right. And let's not waste any time. We'll dive right into our session. Over to you, Maju Chadai.
Hey, thank you. Thanks for everybody who's called in. So what we wanted to, I think some of you might have already attended the one that we did a couple of months ago in January. And I think based on the feedback that we got, what we wanted to do this time was go a little bit more into what actually is mental health and how do these patients actually come across. So what we thought was we'll come up with some of the common scenarios that we commonly see in terms of they're called like basically vignettes. So how do these patients present? What do we see at homes in our own families, in our family members? And then how do we as physicians or psychiatrists see some of these people, and what can be done? So one thing I just want to make sure to inform is that we're not giving out medical advice. This is more for awareness. And in terms of what you do, ultimately, you will have to contact a healthcare provider like a counselor, psychiatrist, whoever in the area that you are in, right? And if needed, feel free to reach out to me as well, and I can talk to you as well. And the other thing is the U.S. being a large country with so many states, the laws vary from state to state as well. So some of the things that we say, because I work in New Jersey, so I know how are some things done in New Jersey. But there are overall, though the principles would be the same, there are some things that would vary from place to place. Okay, so having said that, what I want to do is go through. We'll talk about a few scenarios that we commonly see, and let's see. Yeah. Can you see my screen, Prini?
Yes, we see. Yeah.
Yeah. Okay. So what I'll do is go through about 5 or 6 different clinical vignettes scenarios that are commonly seen, and what do they mean, and how what would be the best way to manage those. Okay. And so let's go with something that we as parents often see, and with and some of the genders are interchangeable. So we talk about let's say a 16-year-old or teenage girl. Okay, so talking about feeling very irritable. So you see them get very angry very easily. They also start to withdraw and isolate themselves from friends. Okay, and sometimes these symptoms, let's say, have been ongoing for a few months, and they have been worsening. And you try to talk to them, and they get very irritable, and they're not willing to talk to you. And a lot of the time, they're not. Then they start to withdraw themselves, not do well at school, become unmotivated, their grades start to worsen, and isolating themselves, not really eating well. And what we see especially with teenage girls, is they get very angry easily with family, and very often it's the mother that they start to get angry with. Okay, so it could be the father too, but very often the mother getting angry, irritability, and really spending a lot of time looking at the phone. Okay, and typically what we also see with these kids is they complain of feeling tired during the day, but when you talk to them, you realize that they are not really sleeping well at night, and that's because they are spending a lot of their time on the phone, and then they end up being tired during the day. Okay, and So parents naturally are concerned about it. And then what does this mean? And some of the most common conditions that this could mean is, one is major depressive disorder. Okay, so what we call depression. So these people could be going through depression. The other thing, especially to consider in teens, is to think about alcohol and drug use, and consider especially marijuana use. And we know that it's legalized now in a lot of states, and it's very, very freely available. And this is and extremely freely available, especially in schools. Again, and starting right from middle school, high school, you have a lot of kids who are using marijuana. And the other thing that I want you to remember is, or be aware, is that very often we think, okay, it's the other kids who are doing it. My kid would never do that. But really, always, and I've never ceased to be surprised by how often a lot of Indian kids, and that too, not necessarily even very smart kids are actually doing it. Okay, so always keep that at the top of your consideration. But the main thing, very often you find that these kids are depressed as well. Okay? And what you need to do is really look at evaluation by a licensed counselor, social worker, or a psychologist. So basically they go under the overall term of counselors or therapists. And also need to very often need to see a psychiatrist. Okay? And the other thing is also to consider the possibility of sexual trauma, molestation, and these are far more common than you might think. Okay, and it might not necessarily just be within their home, but even outside of the home, by other family members, by people who they may not, who they may just know, etc. So really, always consider that. Okay? And what do we do for that is really, these kids need outpatient therapy and very often medication management. And so they might need to be treated with medication. And the other very important also to be aware, especially among the young people, is for the watching out for the risk of suicide or self-harm. Okay, so very often, sometimes these kids, they start to cut themselves, they start to self-injure. Okay, and they and the whole idea of suicide, it's we might think that it will never happen in our family, but as we all know, we all have come across people, either a family or a friend, who have gone through that suicide. So every kid, and the young teens and young adults are at the highest risk of suicide. Okay, so always be aware of that. And if you see something that's happening, whether it is in your own family, or a friend's family, or one of your relatives' family, please feel free to please be willing to speak up and talk to their parent, because most people are not, with the intention of really getting the kid the help that they need. Okay? And especially in teens, so we talk about depression as feeling sad, whereas in teens especially, very often, more than sadness, you see irritability as a symptom. So that's where it's important to be aware of some of these things that happen commonly with these teens. So I'll go to the next scenario. So this is something that we see quite often. So this is basically about an adult with anger. Okay, so and I'm going to look at it from a lady's point of view. Okay, so let's say a middle-aged lady feeling with sadness and feeling overwhelmed, right? So it's very easy to look at that lady and say, okay, you are sad, maybe you need treatment. But when you actually start talking to people, then they realize that it is very often related to the environment around them, and very often around the husband, okay, husband or their spouse. So she states that her husband gets angry very easily, and yells or talks down to her. And when I say talks down, it might not necessarily by shouting at them, but it is still really that whole lack of respect. Okay, and what ends up happening in the woman is that they end up feeling bad about themselves. Okay, so and that when you feel bad about yourselves as a woman, because of your husband's behavior, and that is really what is called emotional abuse. Okay, and he also sometimes pushes her and has hit her a few times. Okay, and just to make it known that you might say that, oh, and I've heard this people people saying this, yeah, he just pushes me or hits me once in a while, maybe once every 6 months or whatever, right? So, but the whole point is physical abuse, even at any point in time, no matter how infrequently it is unacceptable, and not just in this society, but in any society. So these are some of the things that happens when people have emotional and physical abuse. Okay? And then very often you can see that some of these men, they drink regularly and can get out of control in parties, and they have been drinking excessively. They talk very passionately about alcohol, and the focus in any gathering is the drinking part. Okay, so and sometimes, very often, they often also have frequent mood swings and become very angry, and you see that the drinking probably is related to this anger, and then that these some of the drinking has been worsening recently. Okay, and you also see quite often that these men start to become suspicious of the wife's fidelity, start to believe that they are having affairs, and suspects are, and they also start to feel that because their wife is having an affair, that people are not respecting them, and they start to lose respect for themselves as well. Okay, and when you feel not respected, when the man feels not respected, when the man feels that he's at a different level than the wife, and that the wife does not respect him, these symptoms start to get worse, right? The anger gets worse, and the drinking gets worse, and the emotional and the physical abuse also gets worse. What this often does is this has a huge impact on the family. Okay, and the biggest recipient of that impact becomes the children, and they become very uncomfortable with the home environment, and then they start just avoiding any interaction with the family, especially with the father, and then stick to the room and not really talk to the family anymore. Okay, so this is a scenario that we see quite often being played out, and there is a lot of stigma around talking about these as well. Okay, so the very often the woman feels that it is her fault for encouraging this, and sometimes society also talks about it in that way, in such a way that they make it feel like it is the woman's fault, right? And that it is her job to keep her husband under control and the family intact, etc. So very often the woman is feeling bad. I think there is some echo. Maybe somebody can put their phone on mute, please. Okay, yeah. So this is another scenario that's often seen. So what do you do? So here, so there are a number of issues here, right? So you have, of course, the alcohol abuse and the potential mood disorder, and very much these are things that you suspect what is called bipolar disorder or major depression in the husband, and that has and along with the alcohol abuse as well, and along with that you can also have the wife being depressed as well because of the husband's alcohol, the emotional verbal abuse, and also the physical abuse. And this also has implications on the children, and very often the children become depressed, and then they turn to alcohol or drugs to start to feel better as well. Okay? And one important thing here to remember is the whole risk of harm. Okay, so in these kind of scenarios, the wife especially is putting herself at the risk of harm. So if you feel that you are at risk of harm by anybody else, the most important thing is to keep yourself safe. Okay, because if you're not there, just by protecting the husband, you're not going to be either keeping yourself, you're not helping anybody really. Okay, so, and if you are at risk, please call the police. And here again, and this is what we face from time to time, the wife believes that, hey, if I don't disrupt this whole situation, somehow things will get better. Okay, or that I can pray myself out of the situation. prayer is good. I don't say no to that. But at the same time, we also have to do these practical things that need to be done. Okay. So if you feel that you're at risk, please call the police. And in these kind of situations, even when you see a healthcare provider, even when you see a doctor, the whole concept of confidentiality does not apply, right? In the sense that I have no obligation to, the patient has no right of confidentiality when somebody else is at risk from their actions. Okay, so that is really where feel free to talk to either your like a primary care doctor or definitely the police. Okay? Um, Very often, these patients, especially the men, they need an inpatient treatment that is detoxification from the alcohol. Especially when if you have been drinking a lot, you need to be treated with detoxification. And after that, it is followed by a period of rehabilitation. Okay, so and rehabilitation basically is giving them the tools, whether it is medication, whether it is counseling, to ensure that they can stay sober. Okay, and there are what is called AA meetings. Okay, so and these are meetings of people who have a history of alcohol. So they meet together and they get what is called a sponsor to help with their sobriety, to maintain the non-drinking part. Okay? And very often this is followed by what would be called intensive outpatient or a partial hospital. So basically, partial hospital and intensive outpatient are when they when they go to an outpatient setting for therapy a few hours every day. Okay, so it can be about 3 to 5 days a week. They are getting intensive therapy in an outpatient setting. Okay. And then, very often you also need to see a psychiatrist or a nurse practitioner to treat their underlying mental illness, because people don't start off drinking just for the heck of it, right? Very often they do have underlying in some psychiatric disorder, whether it is depression, whether it is bipolar, when they are really drinking out of control. Okay? The other thing is very often you see that men end up blaming other people for their drinking. And very often the blame is on either the wife, maybe her family, or that nobody respects me, that's why I drink, or I cannot find a job because that's why I drink, whatever, right? So really to remember that nobody drinks or does drugs or abuses people because of somebody else's fault. Okay, they do it because of their own problems. Okay, so ultimately, with almost everything, you'll see that the theme is that ultimately you have to take responsibility for your actions. Okay, so and just like with almost everything else, they have a psychiatric disorder, and you cannot. No one should has the excuse that it's because of that I do these things. And if that is the case, then the importance is it's important to get their help. Okay? And the other thing is that you see is that such men often say, okay, now I'll just drink a little bit, right? So I'll just have one peg and I'll stop. And that is possible in some people without an alcohol drinking problem. However, in people who have gotten to the stage where they were abusive towards their spouse, where they were abusive towards your family, etc., there is no such thing as controlled drinking. Okay, it's either 0 or 100%. Very rarely would you actually see someone who had an alcohol dependence or an alcohol abuse problem, but then are able to just maintain their one drink or two drink promise. It almost never happens because they end up being you end up relapsing completely. So this was and I some of these cases I highlight because these are of course things that we see commonly, but also some cases that we have seen within our community, and that has led to some recent quite tragic events. Okay? Another thing that we see very often is, and this is a presentation that we see very often, and it's so predictable now. A 21-year-old college student decides to drop out of college, and again, I must say that these are all actual people that I have seen. Okay, these are not actually made up cases. These are actual people that I see, especially from the Indian community as well. Okay? So this kid, let's say, had done very well in high school, got into college on a full scholarship. Okay, had a lot of plans, had a lot of dreams and aspirations, and now after maybe 2 years into college, is not able to follow through with his plans anymore. Okay, and he makes a lot of excuses about why life is not going the way he wants it to go. Okay? He's not able to focus in school and states that he's not motivated to do anything. And even when he's at home, he spends a lot of his time, especially outside of the house, or he shuts himself in his room, does not really interact with the family or interact with his friends, etc. Sometimes, they do interact a lot with their friends, but they withdraw from the families. And then you also start to see that their thoughts lack clarity and that the sleep pattern is erratic. So when everybody is sleeping, he's awake, and when everyone is awake, he's sleeping, right? So and being out at night for long periods of times, and sorry, okay. His eating patterns are very erratic, and very often families and parents, they don't know what to do. And we end up thinking that, oh, this is a phase that it will pass. Okay, and we see that a lot. I see that a lot in I don't know if it's more in our community, but I see that a lot where people are going to college and then they are going from one course to the other, and then they are kind of getting into this directionless, just going through life kind of thing. Okay, and you see that, and with these kind of people, you also see that many of their friends are also similar. They are also kind of going around without much direction in life, just randomly doing things with no motivation, not really finishing college, not going through education, etc. Okay, and one thing I want to point out here is, you might say, okay, education or college is not the most important thing, and that's and the other very often you hear that, hey, Mark Zuckerberg dropped out of college, and Elon Musk dropped out of college, and all those kind of things. And this is a very common argument that you see. But then you see that they dropped out of Harvard, right? They didn't drop out of community college. Okay, so that's an excuse that many people say that, oh, you have all these big people who dropped out of college and still went on to do a lot of things, but they were really, really smart to begin with. But many of these people, yeah, they are sometimes dropping out of community college and not so great colleges. And then what you see is, even after dropping out, it is not that you're doing something with a great deal of purpose. You're just hanging out at home, right? You're just isolating yourself or just hanging out with your friends, etc. Now, one of the most common reasons that I see, and it's quite predictable now, is that this is a very classic scenario that happens with substance use or drug use. And the most likely culprit here is marijuana use. And like I said before, marijuana use is very prevalent now. You see that right from middle school through to high school to colleges. When you get to colleges, you have plenty of marijuana use. Okay, and then with regular use, what you also end up having is major depression. You end up developing depression. You can have anxiety. But what marijuana mainly does to you is gives you that whole feeling of not being bothered about anything. Okay, so being, oh, I'm chill kind of thing. So there is really no motivation, no drive, no hunger, no desire, nothing to do anything. So you are happy to just be in a corner, just lay around and be very content and very satisfied. Okay. So the main important thing would be really to encourage that person to get help and really to address this head on. Okay. One important thing to do would be drug testing. Okay, so and here you can actually go to CVS and get these quick drug testing that you can do, and you can say something like, okay, very often when you with anybody with any drug use problem, the first they always say, oh, I'm not using anything, or why don't you trust me, etc., right? And then you can say, that's absolutely fine, I trust you. So, you know then if you are saying that you're not using anything, the drug test should be negative, right? And then when you challenge people with a drug test, then they really start to get nervous about it, right? And you don't even have to do a drug test. If a person is objecting to a drug test, it is a fair to assume that he's been using marijuana. Okay? One important thing here to do is not to enable the patient, enable the person. Okay. So sometimes we think that as parents, our impulse is to make sure that the kid is okay and that I'm trying to let's say, oh, let him be there, right? And tell him, hey, don't do drugs, but you can continue to stay here. That's fine. Take your time. But very rarely does not doing anything solve the problem. So just to remind that even providing food and shelter to somebody who is unwilling to change is actually enabling them, right? So when you tell people that I don't expect you to do anything, but you can just stay on in my house and I'm going to keep feeding you, that basically there is really no motivation for the person to change, okay, or to do things any differently. So we very often parents end up enabling the kid and their drug use. Okay? Important thing also is to really to take steps to attain sobriety. Okay? One of the most important thing is to cut off the environment that the person is in, especially from friends who are also using. Okay, very rarely do people who are using marijuana do it in isolation. Okay, they build up a whole community around them. They build up, so their friends end up being marijuana users. So you are constantly surrounded by people who are normalizing it and who are saying that it's absolutely fine, and then they continue to use it. So if you know the parents of some of these kids, okay, and talk to them and try to coordinate help for all of those children. Okay, so it's not enough. Let's say if one of your sons is using marijuana, and if you try to get help only for your son, that's not going to work, because if his friends are using, he will also continue to use. Okay? And what will happen if you don't get help for all the kids around within that your son's social circle, is that if only one person is getting help, the other people will pull them down. Okay? And they might all be good people, and they might, it is just you get back into that environment, you are more likely to continue to use and restart using again. Okay, so it's really important to get that kind of help and take that as a community, in the sense that make sure that these kids who are getting help, their friends are also getting help, and their parents are also involved. Okay? So here again, very often they might need an inpatient rehab, and they might also require very intensive outpatient therapy, going to a sober house, etc., and really identify what are the avoiding triggers. And many of these kids are also drinking, and they could also benefit from the Alcoholics Anonymous. And there's also what is called Narcotics Anonymous, very similar concept. And there are these AA and NA meetings, not just for the people who are suffering from illnesses, but also for families too. Parents and other family members can go to, and that's called Al-Anon, etc. Okay? So that's it's a very major problem that we see with the marijuana use, especially in the last few years. Another scenario, wanting to talk about psychosis. Okay, so psychosis is basically when we lose touch with reality. Okay, and this starts very often in late teens, young adults, and often the first signs are that the person starts to isolate themselves from their family. Okay, so a kid who was pretty normal for most parts, they start to isolate themselves, not really come down to eat with the family, spending a lot of time in the room. Then gradually they start to believe that people are against them, right? And then that people don't, like them. Then they start stopping going to school, because again, they believe that his friends are against them. And then they start sometimes to believe that people are trying to control them. So this is the condition when they sometimes start to hear voices, and they believe that people are out to get them. Okay. getting agitated very easily. And sometimes, and when you challenge them, they start to threaten you or start to exhibit threatening behaviors, etc. And sometimes you see them talking to themselves and mumbling to themselves, sometimes for smiling at themselves or laughing to themselves, etc. Um, and they start to withdraw from life and really has a lack of interest in a lot of things. Okay? And this is very classic of some conditions called paranoid schizophrenia. Again, um, this can also stem from drug use, different drugs, especially marijuana, cocaine, etc. So just using marijuana does not make one schizophrenic. However, when you have been marijuana, cocaine, etc., can precipitate that in somebody who already has underlying predisposition to that. Okay? Now, there is a genetic loading in the sense that sometimes it can run in families. And what often happens with these people, with these patients, is they have very poor insight. They do not believe that they have a problem, and they might sometimes need involuntary hospitalization, to be committed to hospital, etc. And often and the most and you do need medications to control these symptoms. And one thing that you see with these patients is because they do not have insight into their condition. They do not believe they are ill. They do not believe they need treatment. They're not willing to take treatment either. Okay? And even if they start taking treatment, and we see this all the time, the patient starts to get better, and in a few weeks the patient is better, and then the patient says, I'm doing fine. And sometimes the family also starts to say, oh, he's doing fine, why do we need to keep taking treatment? Okay. And with everything, I like to encourage you to look at it in terms of the diabetes or asthma. So if you have diabetes, for example, and your diabetes gets better, you don't suddenly stop treatment and says that, oh, my blood sugar now is under control, I'm not going to take medications anymore. Okay. But we see this, especially in the Indian community, a lot with patients. And sometimes it's even the families who are like, oh, he's doing fine, now let's stop his medication. Okay. So please do not stop medications without proper medical advice. Okay. And and one challenge with these, because of the daily challenges of taking medications, these are medications that come also as monthly injections. So you can take them every 1 monthly. There are some injections that you can just take every 3 monthly, and sometimes there is an injection that you can just take every 6 months. So what that does is you give it as an injection and just remains in your body at a certain level for about 1 to 6 months. Okay. So you don't have to remember to take medications every day. Okay? And the other thing also is that it's very important to get regular follow-up, to continue to be in therapy, see the counselor, and also see a psychiatrist, because these patients sometimes are notorious with not taking medications and also telling their doctors or their counselors or therapists that everything is fine. Okay. And they very often know what exactly to tell them. They'll say, oh yeah, I'm doing very well, I don't feel paranoid, I don't hear any voices, everything is good, my family are happy with me, and then I'm taking my medications every day, right? So they say that right thing to the doctor, and then I can, as a psychiatrist or as a doctor, I only can go by what the patient or the family is telling me, and I end up thinking, oh, everything is fine, no, let's just continue the medication. But in reality, everything might not be fine. So always make sure that if anybody is seeing a doctor or seeing a psychiatrist, make sure that the family is involved as well, and make sure that you're talking to the kid or the family member to say that, hey, I would like to talk to your doctor, or I would like to give them some of my input as well. Okay? So that's about schizophrenia. And so this is another scenario of an adult with depression. And this is a middle-aged or a young adult, 46-year-old lady with no motivation or drive to do anything. And she feels that she has been sad and feels that her family would be better off without her. She feels miserable a lot of the time. She feels she's a burden. And here the husband is supportive, the family is supportive. However, she feels that nobody likes her, and that she's being a burden on anyone. Okay, she does not enjoy anything that she used to do, does not feel like eating, does not sleep at night, and she feels tired a lot of the time with no motivation or drive to do anything. Okay? And she only sleeps a few hours at night, and she ends up waking very early in the morning. And so this is a very common presentation that we see in, especially in women with depression. And depression can just arise out of nowhere. So you don't need, so it's common sometimes to hear people talk about, hey, she has everything, why is she depressed? But it can happen without any precipitants or any triggers. Okay, and very often people with depression also end up having anxiety disorders. Okay? And the most important thing, like we talked about in another case, with anybody with depression is also at risk of suicide. So when someone feels that they are a burden on others and nobody really likes them, it's very easy to become impulsive one day and end up saying, okay, what's the point in living? Let me do something to end my life. Okay? So it's really important to constantly bear that in mind, and also to know that it is okay to talk about these feelings. Okay? So sometimes people don't talk about the suicidal thoughts because they think that it might put the idea of suicide in their mind. But very often, when people have suicidal thoughts, they are actually relieved that somebody asked them about it so that they feel they can open up and talk about it. Okay, so it's, if you feel that someone is depressed, if you feel that somebody is isolating themselves, and if you get that sense about this, it's okay to talk about, hey, do you feel like sometimes you might be better off dead, or that you might be, there's no point in living, or do you feel like that? It's important, it's okay to talk about it. Now, again, here, important things are about counseling, therapy, and also medications, especially antidepressants. And often the theme here is people do very well, and it's important to continue to stay on the medication unless your, a healthcare provider says that you can come off it. So I'm just going through some of these cases, and then we can have a few minutes at the end to have any discussion or any questions. So another common thing that we see, especially in kids, and this also causes a lot of distress to parents as well, because at the end of the day, parents want to see their children succeed. Okay? A 14-year-old boy or girl with difficulty focusing, and they do not finish their schoolwork. They are unable to prioritize their tasks. They may hide their homework and may not turn it in, and they have to read or study multiple times to remember or to understand concepts. Okay? And typically do not like reading. They take a lot of time to complete their work. Okay, gets distracted very easily. They are working on something, and then suddenly you get distracted by the next thing, and you go away. Okay? And they also end up procrastinating, right? So they keep putting off things for later, and end up doing a lot of things at the last minute. Okay? And they also have to be reminded many times to do the tasks, okay? And getting very distracted. And sometimes, even when they're studying, they have their music or TV turned on, spending a lot of time using on the phone, using TikTok, Instagram, etc. Grades, falling grades, doubting their abilities, and things that he or she is dumb, and also worrying a lot about the future and inability to succeed in the future. Okay? So very often, what these people have is what would be called ADHD. Now, it stands for Attention Deficit Hyperactivity Disorder. So the fundamental problem here is difficulty with focusing, difficulty with continuing to maintain your concentration on tasks, and the inability to kind of let distracting stimuli affect you, right? So they might be reading, and then suddenly they hear a car outside, and then you start thinking about that car, or focusing on that. And this is also associated with some specific learning disorders. Some people have difficulty with learning languages. Some people have difficulties with math. Okay. And what is important here is to evaluate for ADHD, and there are different tests to do that. So again, important to see a psychiatrist, for example, and schools also have many of these resources to really to evaluate for ADD. And medications are very, very effective. And these medications, when you take them, they really help your focus, they help your concentration. And you people take them. Sometimes they just take them during the weekdays and don't even have to take them on weekends, etc. So they do very, very well when they get on the right medication. And these kids, they often need accommodations at school, right? So whether you're in school, whether you're in college, they like almost every school has these things for people who have that academic learning difficulties, etc. And they might benefit from extended testing time. So for example, if a test is 2 hours, so if somebody has ADD, they cannot focus, they can get extended testing time. Okay? And that all you need is to talk. There's some paperwork that will need to be done, and the doctor can help with that. Okay, so with those extended testing times, and usually the school will be okay to extend the testing time. So someone, as I said, someone who can do a work in 2 hours, a kid like this might need about 3 hours to do that. But the schools can be accommodating towards that. And they may also need therapy to improve their self-esteem and also need a lot of reassurance. And if you do not treat this, what happens is the kid starts to treat themselves. And that is really where you end up being, you start to develop drug use, especially marijuana use, because very often that ends up being your own self-medicating way of treating the condition that you have. Okay? So I think from a case presentation point, these were a few cases that I put together. And I think this really, gives an idea of approximately about 80 to 90% of the most common conditions that an average psychiatrist sees, or what a lot of people actually go through. Okay? I know that I went very quickly through this, but I wanted to, with regards to the short time, I wanted to really go through this so that everybody knows what are the things that you can look out for. And, like what we are planning is when we have our KCWFNA convention, we are planning like a whole session on some of these, like a seminar or workshop to go into some of these things in more detail. We're partnering up with a couple of other psychiatrists, therapists, etc. So we hope to do it in more detail. So these are some very high-level ideas about what families and what people can do. Okay? So I'll stop there, and we can take any questions if you have any.
Sure. Thank you. Thank you so much, Majishadai. That was truly insightful and very informative. And I think the case analysis and, looking at different cases really sort of broadened our horizons and perspectives. I think we do see such scenarios all the time, every time, but we don't know what to do and when to do. So acting at the right time and being consistent with our action, I guess, is key that we learned today. So, lots of good things that we learned today. I'm sure it was very beneficial for all of us. And as Majidai said, the session is now open for any questions, comments, suggestions. So, feel free to unmute yourself and you can ask questions, or you can also raise your hand if you want, and we can unmute you. Okay. All right. I'm going to do a
Or also
gallery
give
view.
suggestions on how things can be better and more beneficial. That's
Yes,
yeah.
absolutely. Yeah. All right. Any questions?
Preena and Dr. I just want to ask, what about the social stigma around the community itself to come out for the treatment? Number one. And the second question is that if a kid is adult, the parents doesn't have the complete authority to take them involuntary to the hospital or the counselor or the mental health provider unless they are a threat to themselves or threat to the family or others. So how do you manage with the adult population after 18?
That's a very good question, and that is really one of the big challenges as well, right? So one is with regards to the stigma. You're absolutely right, right? And it is easy to talk about some of these things when it is happening in someone else's family, but when it comes to your own family, it is very hard for us to talk about it, right? And I totally understand that, and that is really what we are trying to do here with some of these, where we are, you know, kind of really to talk about how these are normal things that almost everybody is going through, right? A lot of people are going through, and even let's look at a simple thing of when we look at a teenager with irritability. You know, a lot of people go through that, right? So it's about really getting that, and people are struggling with that, right? And it's really about getting that right help, right? And with regards to the how do you really get an adult to get help, that really becomes it is challenging, and that is really where, see, I say this because I've gone through this with people where, okay, there is an adult, but then you are also, so if an adult, if he's not doing anything, let's say he's dropped out of school, he's not working, but then you let him stay at home, you are enabling his behavior too, right? You're telling him that, okay, I'm okay with you continuing on this path, right? So that's really where, as and sometimes it's you might be okay with kicking him out and saying that, look, and at some stage you have to have that tough love to say that, okay, I'm not going to be paying for you to be staying here anymore if you are not going with these rules that I have here, right? And also to encourage the family members around you as well to say that, okay, you are not welcome here either. So it's a tough scenario, and it's a very difficult scenario, but at the same time, it's really important for that person to know that for me to continue to be part of this family, continue to get my parents, input or support or whatever, I need to buckle up and change things. And if you're not willing to get help, it's not acceptable for you to be here anymore. So, I know that that's not the whole answer or solution, but that is only the start, right? So it's really important not to enable people to do the wrong things.
Thank you. So I was working with the youth mostly in my workplace. I had seen, and they are saying that it is a norm to have the marijuana. There is no side
Mm-hmm.
effect.
Mm-hmm. Mm-hmm.
And so people
Absolutely.
just understand with the long time use how that can be affected, and they're denying it. The community denying, the youth denying it, and what we are seeing it is they're saying it is a norm thing.
Yeah, no, totally agree, and we see that too. And every time I talk to a youth, and you're telling them, they say, "Oh, we all my friends do it, and I've not seen anybody have any problems, right?" But then the thing is, everybody's doing it, but at the same time, the problematic kids are not really telling them that they have problems, right? So everyone is trying to say that, "Oh, everything is great, everyone is good," and the I am so people like us, whether I think you also work in that kind of setting, we are seeing the adverse or the end result of what is happening, whereas these kids are not seeing that, right? They are only seeing the fun part of it, right? Whereas you are actually seeing the outcome of that, ultimate outcome of that, right? And like with anything, right? So is alcohol in itself bad? No, right? So a lot of people are able to drink a little bit and drink at a social gathering, have a few drinks, and move on with life, right? But at the same time, and I'm not at all advocating that that nobody should drink. Yeah, I drink too, but it has to be this is for people whose drinking gets out of control, right? And that is really where the problems start to come in, right? And like with anything, so just because eating sweets are not bad, right? But then when you have diabetes, and in spite of that you're eating 25 burfi a day, that is when it becomes a problem, right? So yeah, but good point. I totally agree with what you're saying.
Thank you for all the points. And still, I am kind of a little bit struggling with one of my, I just work some kind of community voluntary work and all everything. One family approached me with they wanted they need help, but the child or adult is not harmful to himself or others,
Mhm.
and try to take them, but there will be a struggle and they don't know what to do. So I just went to the local police area to check with them if there is any help from to get a adult not
Mhm.
willing, and their
Mhm.
answer was unless they are harmful to themselves or others, then only they will help. That
Yeah.
is the struggle our community, some of them having with a long gone problem. They didn't recognize. When it is recognized, that person become adult, and then you cannot force them to take somewhere. They
Yeah,
stuck with.
absolutely. Mhm.
That is the big challenge right now facing with the multiple people where
Mhm.
I know.
Yeah, no, I totally agree. And that is where it's really important to identify these very early on, right? So, and yeah, unfortunately, in these individual instances, I wouldn't know the solution because you're right. But at the same time, if this kid is living at the parents' home, right? The parents are still looking after them, they are feeding them, etc. And I know that it's a very hard thing today, but then recently I went through somebody and it was like, look, the parent ultimately put their foot down and say, look, unless you are willing to do anything to do something to get help, you cannot stay here anymore, right? And very often, especially with drug use, you have to let that person hit rock bottom, right? Because ultimately, none of us wants to change, right? We are all pretty happy in how we are, right? Whether it is good or bad, we want to maintain our own status quo in our life, right? So we're not really looking to change. So you have to sometimes hit rock bottom to for them to be willing to accept help. And the parents have to enable that in terms of helping them sometimes hit rock bottom, right? Because till
Okay.
then, yeah, till then, with something like this, I would say, you know what, and yeah, you can't stay in this house anymore. So then the parents' next question is, yeah, but I can't let him be homeless. Yeah, then that's a choice that you have to make, right? So do I enable him to continue to use whatever he's using and do that, or do I say, okay, now because right now, what is the motivation for the kid to change, right? As long as he's getting his living there, as long as he's getting his food there, the parents
That's
probably
true.
also parents are also are probably giving him money, right? Because he needs,
Mhm.
I'm sure he needs money, and the parents give him whatever, right? And then it's like, why should I change, right? My life is going fine. The parent might have a problem, so just because you have a problem, I don't need to change, right? So you have to find, like with any of us, we have to find the reasons from within ourselves for us to want to change, right? We are not going to change for other people, we are only going to change for ourselves, right? So that is really one thing where, something like this, as hard as it sounds, it might be like, okay, you have to now cut him off, right?
Thank you very much.
Yeah.
That helps.
Thank you. Thank you, Leela Chichi. That was a wonderful question and great analysis, Manju Chedai. Thank you. All right,
Mm.
we have Divya Chichi here who has raised her hand. All right, Chichi.
Hi, Preena. Hi, Dr. Baju. It was excellent, class. With the, what we were hearing about the scenarios. I'm sure our community would have helped a lot more. Only when we say some scenarios will they able to relate to, what are some situations. Having said that, I just want, because this is very informal kind of talk,
Yeah.
I just want to ask you when Leela Chechi was asking, when you were saying the parents are giving money, in that situation, you as a parent, what would you do if you had to deal with a child?
You know, see, and I look, you're absolutely right, right? So it is easy for me as a provider or a neutral person to say, don't do this or do this for a child. But at the end
Right.
of the day, as parents, we might not always do that same thing. But then, having said that, what I'm saying is recently we went through something similar, and ultimately the parent did say that, because and they were also enabling this kid for years, and now
Mm-hmm.
the kid is, he'd made changes, but then he had to hit rock bottom, and that kid now is actually living in a sober house, okay,
Mm-hmm.
with other people who are recovering from this. So they told him, I'm not giving him even a penny. and then now he works as a Uber driver. Okay, and this was a kid who was very smart, who went to college on a full scholarship and dropped out. Okay, and now he works as a Uber driver, makes whatever money he needs. He's really struggling. Okay, but then
Mm-hmm.
that is really what has changed him. Okay, that whole struggle, and even to see that, because see, when see most of our community, we can afford to give our children a few $100s a month, and then you don't have that value, right? But then when they start to go and look out and start to make that money by themselves, that's when they realize that, even to make $200 a day, sorry, not a day, a week, because the
Mm-hmm.
sober house, you have to pay like $200 or something, right? And to make that $200 is very hard, right? So, and to consistently make that week in and week out, and $200, and then you literally you have to make at least an extra $50 for food. And when you're struggling that way and trying to do that, then you realize, okay, the value of that, right? Till then it is like, yeah, my mother, she can, and I've actually heard people say that, right? Oh, my mother, she can do one overtime shift, and she can make so much, right? So what's wrong if she gives that, right? And then they get, especially with women, they make them guilty, right? So these kids, and they go and tell the mother that, oh, all I want is so much, and you can do that like with one extra shift. Why don't you do that and give it to me? Is that because you don't love me? And then the woman ends up being working extra for that son's, basically you're enabling that son's addiction, right? So to answer your question briefly, what would I do? I hope I would do the right thing. Would I do it? I don't know. It's hard for me to say since I haven't been in that situation. But at the same time, I hope that I would be able to do that right thing.
Yeah, thank you so much. Because that's, as a provider, as a doctor, you could always say that, because our community, we have certain culture and norms, until honestly, me, as I was growing, my parents never said that I had to work until I
Mm-hmm,
got a actual degree, right? Neither,
mm-hmm,
my husband was born raised here, his parents never said. But unlike in other cultures where after 16 years, I see, they say, now it's time for you to get out of the house, you have your own living, you can find your
yeah,
job, things like that. I
yeah.
think sometimes I feel, the children, as children, I think you will agree with that too, because as children, when we raise them, we have to give them responsibilities even as daily chores. And
Mm-hmm,
some parents, I completely disagree, because having been in the psychology as a psychologist, I say to parents that you don't have to give money for doing chores to be in your
exactly,
house. When
exactly.
considered that you are living in your house and
Mm-hmm,
this is your home, you
mm-hmm,
don't pay children giving for doing their chores. If you are living, we are giving you food. You know what? This is part of your job. I don't
mm-hmm,
know if you are even able to hear. My son is mowing the lawn, because this is, if you understand this is your home. I think that's one thing we have to get it through our culture to understand. The parents should understand from young age. Children has to be given responsibilities. Of course, they are to study and they have a lot to study. I'm not saying no, just we have gone through that stages.
mm-hmm,
I
mm-hmm, mm-hmm.
think that's one thing that we have to pass through our, all of our parents
Yeah,
to understand that the children has to be taken given responsibility from a very young age.
yeah.
um, I,
Divya, I totally, sorry, go on. Yeah.
yeah, I also have another scenario, but if you have something to say about it,
No, no, I just
please
wanted
go ahead.
to say that I totally agree with you, and
Mhm,
I just want to take that back one point about what you made about, that yes, you didn't have to work, neither did I have to work. I studied in India as well. My parents paid for my education, but
mhm,
and here as well, I'm not saying you should not pay for your education. It's absolutely fine, but then it is, so it's a kind of a contract you're making, right? Look, I will
mhm.
pay for your education, and in spite of, and in return, I want you to complete your education, right? And to take that seriously, right? So
Right.
so that whole point of, yeah, we'll pay for our education, but if you're not keeping your end of the bargain, why should I continue to do anything further for you, right?
Yeah.
So that is the whole point here, right? So that we're all, and I do, if somebody wants to pay for education, that's absolutely fine. If someone does not want to make their kids work, that's absolutely fine. But then there is that unwritten rule, or that other part of their thing, that they do things that they are supposed to do too, right? If you are starting to use drugs, you're dropping out of college, then all bets are off. I don't see a need to continue to pay for your education or pay for your habits or anything, correct? So that's,
Mm-hmm.
yeah, but I otherwise totally agree with you. Yeah.
Yeah. Yeah, this is about a scenario that I recently came across. A young woman, not too young, she has a children who is going through to college now, who's 18, older one, 18 years, who's in the first year college. Younger ones are in the age of ninth grade and seventh grade. And she was, honestly, I was like in a situation, what do I say to her? She's a school teacher, and her husband, um, I don't know what kind of an assessment I would put this as, a narcissist or some kind of a bipolar disorder. So he completely, what he does is he keeps track of her, whatever she does and whatever she is doing, wherever she knows that he's tracking, because for some reason in the phone, when she talks with somebody, she can see a light. She went to a person who looks at the phone, and then he's the one who found it, that somebody is tracking everything that you're talking. And she found a tracker in her car. Husband is tracking wherever she goes.
Yeah.
But in front of her family, he seems to be an absolute perfect husband. But because she is living with that man, she is able to say to me that, she is going through hard time,
Mhm.
living with this. And he's verbally abusive, not just to her, but also to the family children as well.
Mm, mm, mm.
In that situation, what is one way that what kind of help can she get? Is she's already, like, her kids are growing up, and they are in college. Still she's having to put up with this kind of
Yeah,
life. So she's
yeah,
saying, where do I start from and who do I approach?
yeah,
What do you
yeah.
have
So
seen?
yeah, again, tough situation, and this is very similar to something that I went through with somebody recently as well, right? So very similar situation. Again, what the woman did was she kind of had been going through this, but really wanted to make the marriage work, right? And at one stage, there were some things that ended up precipitating a few things, and then she ended up saying, "Look, I'm done with this," right? They did
Mhm.
try a lot of therapy. They did go for therapy, but the most important thing was for to address this with the husband and say that that I feel stifled in this marriage, right? So being constantly monitored. We all want our freedoms, right? So I know that within marriage, yes, you do give up on your some of the freedoms, but at the end of the day, that should not take away your personality as a person, right? You still need to be a person, so she had that discussion, and they tried a lot of therapy, etc. And
Mhm.
then when something else happened, they are ending up now getting a divorce. Okay, and I always try to avoid the whole divorce route, but at the same time, and I tried here too. But then she told me, look, I'm actually so much happier now, right? Knowing that it's just like I just feel free now, right? And she was able to have that conversation with the children, and the children also totally understood it, and they were like, "Yeah, we don't want you in this kind of situation, feeling sad either." Yeah.
Okay.
So, but again, definitely to start off with, important to address that with the partner and start off with counseling. Whether it is, and one good thing to start off would be the marriage counseling, right? There is couples therapy or marriage counseling where you start off with addressing
Mhm.
this.
Yeah, actually, that's what I was saying. I was asking her if there was any reason that I could talk to her husband as well, because I'm
Mm-hmm.
only hearing the one side of the story. So,
Correct, exactly.
yeah.
And yeah, and the other thing is with some of these things, especially when it comes to marital conflicts and intramarital conflicts, there are three versions, right? There is a husband's version, there is a wife's version, and then there is a truth, right?
Mhm.
So and they might be totally different, right? So yeah,
Yeah, so that's what I was that's what I was in hesitation to give out any answers to her, because
yeah. Mhm.
yeah. And then she tries to call from some the from the work phone. That's the only way that she can at least
Mm.
talk. uh,
Yep. No,
so
this sounds
that.
like a, yeah. So it's important, again, sometimes not to give too much advice, but just to
Mhm.
listen, right? And
Right.
so that they can go in that direction. That would be best for them, and that is where, yeah, that couples therapy. And then sometimes when you're sitting with the, with the therapist and really to address that. Yeah.
Right. Actually, and not only that, I mean, as you said, each state has its own laws and rules and regulations. So I
Yeah.
told her, her husband is not willing to go for any therapy. He said, I don't have any problem. If you have problem, you can go for therapy. That's also like, one of a very common thing that we are actually hearing across right now.
Yeah.
Usually, one of the spouse says, I don't have any issues. If you have therapy, you need a therapist, you can go to a therapist and listen
Yeah.
to whatever therapy you need. So
Yeah.
yeah, those are
And
some
there,
things that our community is facing right now.
yeah. Yeah.
Yeah, yeah. And one other common that we are coming across in our community is also a lot of narcissistic behaviors. Yeah, I mean, women and men, where they have their own ways of you know them controlling and things like that, which becomes a very difficult situation, so which
Yeah.
gives them lack of freedom. So I think those are maybe if maybe during the convention time, that's something that we can address, because it's a whole community there. Talk a little bit about to address about what is narcissism and how can
Yeah.
people combat with narcissistic personality, and how is one spouse living with narcissistic personality.
Yeah.
uh, how is something that they can deal the situation. Those are,
Yeah.
because when a community is enlarged in a place, it's both the spouses are there, so they'll really understand what it is and how they can cope with this kind of personalities.
Yeah.
Thank you,
No,
Dr.
good
Murthy.
picture. Thank
Wonderful.
you. Thanks. Yeah.
Thank you so much.
Thank you. Thank you, Divitichi. Those were some excellent points. Yes, I think there is a point where there is a denial, right? If you do something wrong, you don't accept that you're doing something wrong. So wrongdoing is normalized. And that's when everybody becomes a victim. So, yes, we have to work on getting that straightened. And hopefully we will achieve our goal. So,
Yeah.
Yeah.
thank you.
Another
We have,
thing also, Prerna, I just want, many a times in our communities that our women or, men doesn't even open, even if there is any form of verbal abuse also, they don't even like, bring that out. They just feel
mm,
it's less to even bring that out. But,
right. Yeah.
women, don't open their mouth until they go to a real situation where, which we saw in many situations, in different places, to the extreme of stabbing and to shooting and things like that. We don't want that to be happening in our community or any community, so in that situation they should open when there is some issue. They should be ready to open and go for to address that to a
Correct.
doctor,
Yeah. Mm,
so, or that's also another thing that we need to talk about when there is a situation when there is a physical abuse. What should the women do? That's something that should be addressed to our community, because they don't know. Okay,
Yeah.
okay,
Yeah.
I get a hit. Hey, you know what? You have been raised by a different parent. Who is your husband to hit you? Yes, husband is an integral part. It's when we take the marriage go for good and bad, everything we are together. But wife is not a child anymore to get hit from the husband.
correct.
So that's one thing that we have to address. Women should open their mouth if they get hit, to say, this is not an acceptable behavior where you can hit the wife and things like that. So those are some things that we have to get through our culture to make understand this is not acceptable.
Yep.
Right. Right.
Absolutely.
And knowing when to say no to abuse, right? That's key. And
Right.
I think that comes with a lot of awareness and such educational sessions. And knowing that every action has consequence.
Yeah.
Oftentimes, what happens is people keep on abusing and they think it's okay because it's normal, everybody does it. So I think it's important that we educate people and let them know that, hey, it is not okay, and there will be serious consequences for your actions.
Yeah.
So that is something, yeah, we will
And
definitely,
to
incorporate and talk about.
yep, and
Yeah.
to say
Talk
that
about
it's
zero
it's
tolerance. Talk
yeah.
about zero tolerance.
Yeah,
No,
and
no
to say that
to
it's not normal, right? So you might think it's normal, but it is not normal. Most men are not going
Exactly.
around,
Yeah.
abusing their wives, right? So
Right.
yeah.
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 it.
Exactly. All right, very good. I think we have
Yeah.
someone else who has raised her hand. It's Bindu Lukos. Bindu Chechi.
Hi, thank you. Yeah, I just have a question about this ADHD.
Uh-huh.
And when the kids are on some medications, how long is it like a lifetime issue? How long do they have to take that? And if there is any major, side effects that we need to worry about?
Yeah,
Please
that's a very
explain.
good question. So what I see very often is, see the whole with the ADD, you have a difficulty with focusing and maintaining that focus, right? So
Yeah.
and the demand on our brain, it changes from at different stages in our life, right? And I have, so for example, patients who I was seeing as a teenager, right? And they were in high school, they needed to focus a lot, they get very anxious, very stressed, and they would be on medication. Okay. And then once the high school is over, they didn't really need to be on medication that much. Again, and I'm thinking of a kid. So, for example, and then when they go to college, there are periods when they need to be on medication, where they need to focus and all that. Then sometimes after a while during, and here college from May to August, there's no college. So those days, they don't really need to be on medication, right? And then they stop taking it. Then this person then ended up going to medical school. So they had to be on medication to, study through their MCAT and everything. The first couple of years of medical school, lot of work, they had to take their medication. By the fourth year, when they are almost finishing medical school, I give them a prescription for a month and it would basically last them for 6 months, because they didn't really need to take it. And now that person is doing their residency, they don't need to take the medication at all, because it's a lot of work that you're doing in residency, but you're not like hyper focused, right? It's not like a studying kind of exam. So my answer is, it depends on what stage in your life. And very often with a lot of young kids, sometimes you see that as they grow older, they feel lesser and lesser need for medication. But having said that, there are also many adults who suffer from ADD, and there are adults who start taking their medication, and then over a period of time, when they get a promotion, they become in a they get managerial responsibilities and all that. They feel that they cannot cope with that, then they end up starting to take medication. Okay. And those kind of people often sometimes don't even take it during the weekends, right? So because these are short acting medication, they only last for the that one day, and it's out of your system. So in terms of side effects, overall they are pretty well tolerated, and there are not really major side effects. One potential is people, like the most common side effects are, they can have insomnia, they can have poor appetite, but usually most people tolerate it very well. And one of the risks is also addiction, because some people do abuse these drugs, okay, mainly in college campuses and all that. But it's not, as long as you're monitoring that, that this person takes it responsibility, it's a very small proportion of people who do that. So overall, they are pretty safe and effective. And like I said, people who are untreated, they are more likely to start medicating themselves, because and you see that they end up, they do have higher rates of alcohol use, higher rates of marijuana and other drug use as well. But so overall, it is pretty safe, and people do well on them.
Okay, thank you.
All right. Thank you, Bindu Chechi, for that question. Thank you. All right. Any other questions, any comments, any suggestions, any other specific topics that you would like us to cover maybe in the next session? Anything? I guess that's it. And if you all have any questions that you don't feel comfortable asking on this platform or forum, please feel free to reach out to us, and we will certainly connect you with Dr. Maju Matthews. All right. Now, before we wrap up this session, first of all, I'd like to thank Dr. Maju Matthews for his time and so much knowledge that he's given us today. And thanks to all of you for joining this session. Your participation is key. And as we discussed before, and as Majid I said, we are going to offer an in-person session on mental health during the convention. So if you are coming for the convention, or if you know anybody coming for the convention, do spread the word. Encourage everybody to join this session. We will have Maju Chatai on the panel, and along with him, we also have some very, professional people, psychiatrists, child psychologists, a lot of people on the panel. And this is not going to be just a one-way presentation. It's going to be a panel discussion. We'll all get an opportunity to speak and discuss. All right. So please don't miss this opportunity. And our next virtual session will be more of an advanced class, and this will be on October 19th. All right. And in between, if you want any extra sessions, or you feel that we have to touch upon this topic, feel free to let us know. We are all here to help each other. All right.
Yeah. Great. Thank
Okay.
you.
So
Thanks everyone for your time
thank
on
you.
a
Yeah.
Saturday
Thanks
evening.
everybody for joining.
Yeah. Yeah. Thank you.
All right. Have a wonderful rest of your weekend. Have a good evening, everybody. Bye bye.
Yeah.
Thank you.
Thank you. Thank you so much.
Thank you.